Right, so I'm Shawn. A lot of people know me online as the mental health runner. I do a lot of stuff to do with men's mental health and general mental health, really, to try and help people through really my own lived life experience. I was a maintenance engineer, so I worked in like a workshop, and it was really hard. There was about, how many of us? 8 to 10 of us in there, but then the factory was huge. The environment I was in was very much a man's environment, and it was almost like you can't show any weakness. But reality was I was working and struggling, really. I was struggling to be in that environment, going home and just locking myself in the toilet and crying because actually I'm not coping. I'm finding life really difficult. But I didn't know how to communicate that to somebody because growing up I'd always thought that, you know, man up, you can't cry, you have to be getting on with this, and no one else shows any weakness. So I carried on in that function. But I think going forward, when I got to the stage where I was at what I class as my worst in 2016, 17, I literally felt like I fell off a cliff. My life cascaded quite quickly from around the October time, where I was still actively running, to the December. The drop off was incredible. As soon as I stopped exercising, I stopped engaging, I stopped talking, I started self-harming. I started having incredibly bad thought patterns to the point of obviously suicidal thoughts. I remember sitting on the bed and I had all of these medications on my bed, all antidepressants, all other tablets that I had at the time. And it was like the question in your head of you're asking yourself backwards and forwards, shall I, shan't I? I'm going to take these, no I'm not. I'm going to take, no I'm not. That one split decision you make can change your whole life. You go from that point of actually thinking that your life's not worth living anymore, life will be better without you in it. And at that moment, I took all of those tablets. And it seemed like a lifetime, it seemed like ages. But within 5 minutes, I then went into a mass panic. I then rang my wife, rang her in tears, saying to her, I've just taken all this medication. Obviously, her life goes then into meltdown, not knowing what to do. She rings an ambulance. They got me to hospital. When I got to hospital, they made me sick, sicked up all the medication. At that time, I didn't know what to think. I didn't know what to do or anything like that. I had mental health teams come and see me. I was then told that I need to be taken to a mental health facility at that point. I felt probably more scared than I've ever been in my life because I didn't know what to expect. And the reality was that's where I needed to be to make me safe. That was where I needed to be. I mean, I was doing so many unpredictable things during that period of time. All my loved ones around me, my parents, my family, my wife, I've got kids at that point. But I didn't see any of that. All I saw at that moment was, I don't want to be here anymore, and actually you'd be better off without me in your life. And I find that now when I talk about it, unbelievable, because what I would have missed now would be huge. But in that moment, the horrible bit about that thought of being suicidal, you don't see that bigger picture. You don't see any of that. And I think the big thing is for somebody who's in that situation at the moment, you can't see forward. You can't see that life will improve. You feel like life will be like that for the rest of life. But we're not very good at actually dealing with our own problems. We're quite easy to help other people. We're very good at that. And that's the bit that I find quite hard as a man, because when you look at it, on paper, we're very good at helping other people. We're just really bad at helping ourselves. And so it's just trying to give men that idea that you're just as entitled to it as the next person. And actually the only way you're going to get help is actually if you talk about it. My workplace at the time was the biggest thing. When I was in engineering, I came back to work. I was very lucky, my work were really good. They gave me a phased period back to work. But when I came back to work in a men's environment, the 8 to 10 guys I work with regularly, none of them asked me really, where have you been, how have you been, or whatever. They just welcomed you back. There was not really, I've been off for 9 months, do you know what I mean? It's like a long period of time not to be at work. So my occupational health nurse said to me, like, you're doing really well, how you going? And I came in one day and I said, I'm really struggling with my work people because nobody's really talking to me, nobody's asking me anything. And I said to her one day, I said, look, I think I'm going to tell them what's happened and where I've been. And that was almost like my biggest thing that happened with my journey going forward. Once I told them, and it was like somebody turned the stereo off in a room, but it was one of those moments that it opened up a whole new world to me, because these people then started talking to me about their own experiences. They then started talking to me about their friends' experiences. My life now is obviously different to what it was back then, but I still have real difficulties. I have really tough times. I still want to be that man who tries to support my family and my friends and all the other bits and pieces, but reality is I'm struggling because things are difficult, but I'm acknowledging it by talking about it. And that's where so many people don't. And it's silly because we all struggle. We're not immune to it. You know, it's not like you can just switch it on and off. My generation, there's still so many men that don't want to go down that route because they're scared of that route. They're scared that they're going to be seen as weak, or they're going to be seen as not a real man, and all these other things. If men were to start to actually say to each other, look, today's been a really bad day and I've really struggled and I really don't know what to do, we'd find it easier, but we don't. We tend to, when we go out and meet each other, we go, oh, did you watch the football last night? Or did you go and see that there? You don't ask about personal questions. We just don't do that. We're not in touch enough. My wife used to say to me, did you ask how such and such was? I didn't, because that wasn't in my remit to do that. My thing was, when I turned up, was probably to put on a face and be the man and deal with being in a group of guys instead of what I should have been doing when I was going there. Yeah, I'm struggling with this situation, and I could really do with a chat, because I was always have had that fear of somebody thinking that I was weak, you know, and that's really ridiculous, because nobody is weak. It's just that at different times we find life easier or harder, don't we? That's just how it is.